Hi, my name is Estee. I am a pharmacist and I am currently doing my PhD in the pleural medicine unit at the Charlesworth Hospital in Perth, Western Australia. In this video, I will summarize the findings of the TAP-IPC study, which is the first study to investigate a long-term preventative strategy using topical mupirocin prophylaxis for infections of indwelling pleural or peritoneal catheters. Indwelling pleural and peritoneal catheters have established roles in the management of malignant pleural and peritoneal effusions, but catheter-related infections remain a major concern. To date, no effective strategies have been tested for the long-term prevention of these infections. In peritoneal dialysis, studies found that topical mupirocin prophylaxis significantly reduced peritoneal dialysis catheter infections. Whether the same strategy can be extrapolated to prevent indwelling pleural or peritoneal catheter-related infections is unknown. In this study, we aimed to investigate the compatibility of IPC material with mupirocin using the scanning electron microscope and to determine the feasibility, tolerability, and compliance of mupirocin prophylaxis in patients fitted with an indwelling pleural or peritoneal catheter. Firstly, 3 commercially available formulations of mupirocin were applied onto different segments of IPCs 3 times a week for up to 6 months. IPCs were then examined at different time points, and no structural catheter damage was detected. In light of these findings, consecutive adult patients who required an insertion of indwelling pleural or peritoneal catheter with no history of allergy to mupirocin were prescribed mupirocin to be applied around the catheter exit site after every drainage. Patients were then followed up weekly for up to 6 months or until death if sooner. This study included 48 patients who required insertion of 50 indwelling pleural or peritoneal catheters. During the study period, 28 catheters were in situ at the time of patient's death, 20 catheters were removed, and 2 catheters were in situ with ongoing drainage at the end of the follow-up period. Compliance with mupirocin application was excellent, with more than 95% of scheduled doses delivered. Mupirocin was also well tolerated by all patients. In this study, the observed infection rate is within the huge range of reported rates in the literature. Due to the small sample size and the lack of a control group, we are not able to draw any definite conclusions regarding the efficacy of mupirocin. Nevertheless, this is the first study towards finding a long-term preventative strategy for infections of indwelling pleural or peritoneal catheters. This study was deliberately set up with minimal exclusion criteria to ensure that the results are generalizable. We found that topical mupirocin prophylaxis was feasible and well tolerated in this patient population, and this would form the platform for future randomized trials to determine the efficacy of mupirocin prophylaxis. I would like to thank Respirology for giving us this opportunity to promote our manuscript, and thank you for listening.